Hi, my name is Rosa Guerra, and I'm a Gynec Fellow at the University of California, San Francisco. I'd like to present our research on the role and race of ethnicity in clinical trial knowledge among patients with a gynecologic malignancy. It is well known that differences of incidence rates and overall survival of gynecologic malignancies exist between women of varying racial backgrounds. Black women, compared to white women, are diagnosed at a later stage, often have higher grade disease, and have worse cancer specific outcomes. Investigating disparities in a relatively homogeneous environment, such as clinical trials, can assist researchers in identifying causative factors and analyze the effectiveness of new therapies available. We designed a cross-sectional survey study to assess knowledge of clinical trials among white and non-white gynecologic oncology patients. Questions were derived from an existing validated questionnaire with prostate cancer patients. Study participants were recruited from UCSF. Women were eligible if they were 18 years and older with a known diagnosis of a gynecologic malignancy and were able to read in English, Spanish, or Chinese. Participants were approached in person based on convenient sampling and completed a survey using an electronic tablet. The sample size for the study was dependent on an above average score for baseline knowledge of clinical trials. Though limited information is available on baseline knowledge, we estimated the baseline scores using data from the prostate cancer study and extrapolated that men and women of similar ethnic and racial backgrounds had comparable knowledge. Our patient population included a total of 214 patients. Survey data was collected in REDCap and imported into data, and descriptive and multivariate analysis was performed. The study aim was to identify knowledge deficits regarding clinical trials and to guide future educational tools. Knowledge assessment was based on 9 true-false questions. Questions range from patients' rights, consent forms, and funding. 1 point was given for correct responses with a maximum score of 9. When comparing baseline characteristics of whites to non-whites, there were statistical differences noted for age, education, birthplace, clinical stage, and health literacy. The median age of participants was 58 years, and 75% of our patients reported having an education of at least college and beyond. In the overall patient population, the mean score was 6.9 and 43% scored above average. Comparing whites to non-whites, the mean score for whites was 7.5 and for non-whites was 6.3. This difference was statistically significant. Statistically significant variables were age, education, birthplace, stage of cancer, and health literacy. And after controlling for these variables, whites were 2.7 times more likely to have an above average score. In conclusion, we determined that a racial and ethnic disparity exists regarding knowledge of clinical trials. Despite controlling for confounding factors, white participants were 2.7 times more likely to have an above average clinical trial knowledge score compared to non-white participants. Although not presented here, further analysis showed non-white participants overall utilized less resources when compared to white participants. Studying which resources are associated with above average knowledge scores and specific analysis of resource utilization by racial and ethnicity can help with the development of culturally diverse education tools. Thank you.